Mr. Bhaskar Ramamurthy, Director, IIT Madras, Professor MacGregor, World Action on Salt and Health Founder Chairman, Dr. Soumya Swaminathan, Deputy Director General, WHO Programs, Anita Makhijani, Scientist, Food Safety Standards Association of India, Dr. Somasundaram, Additional Director, Public Health, Tamil Nadu, Professor Muraleedharan, Professor of Humanities, IIT, dignitaries and friends. You may have two questions. One is about Sapiens Health Foundation, and the other, why should we have this Salt Fight Conference? Sapiens, the word sapiens in Latin means wisdom. So human beings are called Homo sapiens. We are different from animals in that we are more wise. So this foundation, Sapiens Health Foundation, was formed in 1997. I am a nephrologist and I started my practice in 1984 in Chennai. One of the things that we face in private practice is that halfway through treatment, patient runs out of money. What do you do in that case? The hospital management advises us to abandon the treatment. If we send to the government hospital, the government doctors are not happy, patient is not happy. What do we do in such situation? So I started this foundation in 1997 to help these people. So we started helping initially on dialysis, for dialysis and kidney transplantation. We continue to do so till today. But what we found was, if a person gets a kidney failure, in his lifetime, he almost spends 25 to 30 lakhs. He has his treatment, his dialysis, kidney transplantation. This is enormous money. We cannot afford. Even developed countries can't afford dialysis as a budget. So what is more important is to prevent. Even if we can prevent one patient, obviously, we are going to save so much on the money as well as the quality of life. So we looked up at prevention, and in 2005, we started screening the population locally, especially the college students, for early detection of kidney disease. This we started in association with the Japanese people, the Professor Toma and Tanabe. They are the world leaders in prevention. In Japan, it is mandatory that every year the urine examination of a child is checked for both protein loss and RBCs. That way they detect kidney disease early, and they have been able to prevent a large number of dialysis. So we have to learn from that. So we started screening the college students in and around Chennai from 2005. And what we found in an alarming state was that we published this data in the International Society for Renal Sciences, as well as we presented it in the American Society of Nephrology. We screened 2,158 students, and about 36% were overweight. The body mass index, when we take the height and weight, was more than the recommended levels. And about 6% had systolic blood pressure of more than 130. And about 5% had a diastolic blood pressure of more than 90. So this was very alarming in college students, where in the age group of 18 to 20, where the blood pressure normally should be 100 systolic and maybe diastolic of 70, we are finding such a high incidence of blood pressure. So blood pressure, as you know, is the #1 killer in the world. We have subsequent speakers. We have Professor MacGregor, we have Soumya Swaminathan from the WHO, who would highlight to you the #1 killer in the world is hypertension and its complications. According to WHO, about 9.8 million people die every year due to heart attacks, strokes, or kidney failure. So hypertension is still the #1 killer in the world. And what is the cause, the commonest cause of hypertension? Anywhere I go and give a lecture, I ask them what is the commonest cause. The first thing they come out and tell is stress. Friends, it's not stress, it is salt. So it is the salt intake which is responsible for the high blood pressure. So then we started concentrating on the salt intake in the population. WHO recommends us to take 5 grams of salt per day. Salt is present in 3 forms in the food. You have the salt that is present in the natural food, which is about 1 gram. Next is the salt that we add while cooking, and thirdly the salt that is present in processed food. So we started targeting on salt control. So we have been holding walkathons, trying to educate people. We have Crazy Mohan with us sitting here. He is our ambassador. He says, salt la salta irka kudadu. It means don't be careless with salt. So he has been promoting it for us. Of course, I'm sure he has also reduced the salt intake. He always asks me, what will happen if I totally stop salt? Graham MacGregor tells nothing will happen. So he has been our campaign. So we have been promoting it, writing articles. I wrote even in the Jet Airways magazine. You know, when people travel in the aircraft, they are ready to read anything. That's the only time they are so free. They would read anything, like a doctor's office, of course, when they sit out. So there also we wrote about salt. So this campaign has been going on for the last almost 5 to 7 years. The other thing that we found, we took a recent survey before this conference, where we found that about 30% only were aware. Again, about 4,100 people were surveyed, mainly college students. We found that about only 30% knew what should be the approximate permissible level of salt intake per day. 70% were not aware. Similarly, 20% only knew that it is important to see processed food or packed food for the salt content. 80% did not think it is important. But majority of the people thought there is some association to blood pressure. At least that is there. That people know that salt is connected with blood pressure, although they have not still been aware that they should reduce salt intake in the population itself. So I thought it's the right moment. We should get Professor Graham MacGregor. I've been trying for the last couple of years to get him to India, and he tells me that in 64 countries already there is a movement to reduce salt, and it is late in India, but still it's never too late. So we have this, when I programmed today, when I started distributing the cards, one of the first person asked me is, we are in a tropical country, why should we eat less salt? We sweat, so we should take more salt. Friends, the amount of salt that is lost in sweat is very negligible. It's less than, I would say, 2% or 3% of the body's salt. So, I mean the blood levels. So it's extremely low. Even if you salt, what you require is water, not salt. If you take salt, your blood pressures are going to go up. The other thing is, we have a saying, our Indians, especially Tamilians, knew that salt is a very important. What is it used for? It's used as a preservative, not for the taste. We have a saying, Uppilla Pandam Kuppaile. What it meant was not that there is no taste, you should throw it, but it meant that it would ferment. The bacterial growth would increase. But now in modern days, you have different ways of preserving food and refrigeration. You don't require to add so much of salt. Professor Graham MacGregor was telling me that you require to add at least 15% of salt to use it as a preservative. So you don't require to really add salt as a preservative. We also have saying, probably our old ancient people knew that salt is connected with blood pressure. So there is a saying that if you have salt, you will have rosham and soranai. It meant, probably it referred to temper, but it referred to blood pressure. So WHO permits us 5 grams of salt per day. I am sure Professor Graham MacGregor will convince you probably we require even less. Ending on a lighter tone, lighter vein, one of the things that patients always ask me as a doctor is diet. They ask me what diet to eat. So if somebody is above 70, I tell him you restrict little. Again, Graham MacGregor tells me you should be tough even with people who are above 70. And when they are above 80, I tell them you don't have to restrict. You're already 80. You can eat what you want. Now, what happens when somebody who is above 90 who asks me what is the diet I should take? I ask him, please tell me what is the diet you're eating I can recommend to others. Thank you.